Imagine this. You're on a video visit, and your loved one is trying to show a new rash. The connection keeps freezing until all you see is a pixelated flash, and that one crucial visual cue gets missed. Later, the clinician finds out the rash was spreading faster than anyone realized. That delay matters. Today, I'm going to help you make sure a telehealth visit doesn't let important details slip through the cracks. Let's separate medical fact from fiction and set you up to run an effective, safe virtual visit.
Hi, I'm Nurse Jessie. Quick note before we begin. This episode is educational, not a substitute for your clinician's advice. If something feels urgent, treat it as urgent. Go in person or call emergency services. I'll remind you of red flags as we go. Also, tiny teaser, I'll include a downloadable fillable checklist and scripts you can use word for word.
First, a quick reality check. What clinicians can and can't assess over video or phone. Video is great for wounds, rashes, some mobility checks, and visual follow-up. Phone only is fine for history, medication questions, and triage. But anything that needs a reliable physical exam, like listening to lungs or feeling a swollen, painful joint, usually requires in-person care. Think of telehealth as a powerful screening and convenience tool, not as a replacement for hands-on assessment when that's needed. Now, let's get practical with a short tech checklist. 5 simple items to test before your visit. These will save time and keep care safe. Item 1. Test your connection and the app the day before. Open the video platform, make a quick test call, and confirm audio and video work. Item 2. Charge your device or plug in. Low battery kills a visit fast. Item 3. Find a quiet, well-lit spot near a charger and your Wi-Fi router. Item 4. Have a second contact method ready, phone number for the clinic, and a backup phone line if video fails. Item 5. Close other apps that might slow your device, especially anything using video or big downloads. Low bandwidth options, because not everyone has high-speed internet. If video keeps dropping, switch to a phone visit or ask if you can send photos by SMS or secure patient portal message. Many clinics will accept high-quality photos taken with your phone, and some will let you text them ahead. If you don't have reliable service at home, public libraries and community health centers often offer private rooms with connectivity. Don't skip care because of bandwidth. Ask about these alternatives early.
Next, privacy and consent. Where to sit, who should be present, and what to ask. Sit somewhere private where others can't overhear sensitive details. If a caregiver is joining, introduce them at the start and confirm consent with the clinician. Ask the clinician, is this platform secure? Will this call be recorded? If you need interpreter services or assistive tech, request them before the visit. I'll give you exact wording later.
What to prepare. 2 quick documents will save the visit, a symptom template and a medication list. Symptom template. Write down the main complaint, when it started, how it's changed, what makes it better or worse, and any related symptoms. Bring any photos or symptom logs. Medication list. Include prescription and over-the-counter meds, doses, and when you last took them. If possible, have that list typed or on your phone so you can copy-paste or show it quickly. Okay, time for the role play. I'll model a short, natural opener you can use as the patient and a clinician-style response. Remember, this is an example. Adapt it to your situation and confirm details with your clinic. I'll read the patient first, then shift into the clinician voice so you can hear the cadence. Thanks, Alex. That gives me a helpful start. Can you point your camera at your throat and tilt your head back slowly? If the video quality gets fuzzy, can you take 2 close-up photos and send them through the patient portal or SMS now? Also, do you have any trouble breathing, drooling, or severe swelling? If so, I need you to get evaluated in person. I can try the photos. Also, will you need me to open my mouth wide or touch the spot that hurts? Please open wide and point to the exact spot. If you can safely press the area and describe pain level, say it on a 0 to 10 scale. If video is poor, photos plus your description help me decide next steps. That short exchange shows 2 things. 1, give structured, specific information up front. 2, be ready to assist the clinician. positioning the camera, taking photos, or following simple self-exam instructions. Which brings us to camera, lighting, clothing, and clinician-guided self-exams. Camera and lighting. Set your device at eye level or slightly above. Prop it on a stack of books if needed. Natural light facing you is best. Avoid bright windows behind you that make you a silhouette. Clothing. Wear something that gives easy access to the area being shown without being exposed. Short sleeves for arm or shoulder checks. Button down for chest exams if needed. For self-exams, clinicians might ask you to press gently on a joint and report pain. Open your mouth and say, ah.
Now, conservative red flags. These should prompt in-person evaluation or emergency care. Shortness of breath with difficulty speaking, chest pain that's new and severe, sudden weakness or numbness on one side, severe uncontrolled bleeding, high fevers with confusion, or signs of severe infection like rapidly spreading redness or a very tender swollen area. Remember the microcase from the start. A bad connection hid the spreading rash. If you suspect anything is getting worse quickly, insist on an in-person assessment.
Accessibility and caregiver tips. Exact phrasing you can use. To request an interpreter, say, I need an interpreter for my visit. Please arrange one in language. To request assistive tech, I need captions or closed captioning for this video visit. If a caregiver is joining, say, this is my caregiver, name, and I give permission for them to be on the call and to share information with the clinician. For surrogate workflows, ask the clinic how to submit photos securely and whether they accept caregiver proxy logins or documented verbal consent over the phone. Backup plan and documentation. Before the visit, ask the clinic, if our video fails, do we switch to a phone visit or reschedule? Who do I call? After the visit, request visit notes or a summary. Can you send a visit summary and any test orders to my patient portal or email? If you need follow-up or something changes, know the clinic's phone escalation path so you aren't left guessing. Before we close, 3 concrete takeaways you can use right now. 1. Run the 5-item tech check the day before. Test video, charge, quiet spot, backup contact, and close other apps. 2. Prepare a 1-page symptom template and up-to-date medication list. Have it ready on your phone or printed. 3. Know your backup plan. Phone fallback, SMS/photo option, and the clinic escalation number. I'll put these as the top 3 items on the downloadable Fillable checklist. You can find the 1-page Fillable checklist, sample scripts, and a plain text version on the episode show page. If you like this episode, subscribe to the show so you don't miss future practical guides. And if you have an anonymized telehealth scenario you'd like me to discuss on air, submit it through the site. I'll use real examples, names removed, to teach what to say and what to watch for. Final quick anecdote. I once had a patient whose call dropped while showing a small wound. Because they had a backup plan and sent photos to the portal, we diagnosed an infection early and avoided a trip to the ER. Small prep made a big difference. Take those 3 steps and you'll notice the difference too. Until next time, stay informed, stay compassionate, and always put safety first.